So you, in the course of your employment at the South Shore Health, is it?
Yes.
How many times did Lindsay meet with you?
Meet with me was 3.
And how many times did she meet with, does that include medical?
Yes, I saw her twice, telehealth once in person.
And do you know how many times that, you know that she had a psychiatrist that had been treating her since end of September, early October, right?
I knew that she had a psychiatrist that treated her in September,
And who was that?
Dr. Tufts.
And did you know that she continued to see Dr. Tufts through October, November, December, the same time that she was reaching out to you guys for help too?
I was aware she took the Zoloft in October. I was not aware she was still seeing Dr. Tufts in November. And I knew she called her in December.
You would agree with me that young woman came to you people for help, right?
Yes.
Okay. And she was very, very forthright. In other words, if you wanted her to sign a HIPAA form, she'd sign it, right?
Right.
And she would answer your questions to your perspective in an honest fashion.
Yes.
You didn't really hide anything.
Nope.
She told you all about the medications that she had been on and her fears and concerns about the medications, right?
Correct.
She described for you, as District Attorney brought out, what she felt her symptomology was, including suicidal ideation, worrying about suicide, feeling heavy, lethargic, you can't get out of bed, all of that stuff, right? Correct?
Correct.
And one of the things that you had left us with towards the end of your testimony is the fact that you were very willing, if you will, to work in tandem with other providers. In other words, you were concerned about being able to get information from other providers that had been dealing with her, treating her, right?
I'm not sure I understand the question.
Did you talk to Tufts?
No.
Did you ever get access to Tufts' medical records?
No.
Do you know how many times she saw Dr. Tufts?
I do not.
Would it surprise you if I told you that she saw Dr. Tufts 14 times in the time frame of October, or the end of September, October, November, December, and then January, 4 months?
Yes.
And that's 14 times plus the 3 that she saw you. Is that right?
Yes.
So that's 17 times that this young lady had access to healthcare providers for her mental health issues, correct?
Correct.
And that would be within a compressed period of time. I know it's the last week, I believe, in September, but October, November, December, and then January, right?
Yes.
And during that period of time, you're aware that she was provided many, many, many prescriptions for antipsychotics, selective serotonin reuptake inhibitors, benzodiazepines, all of that, right?
I'm aware she was prescribed other medications.
She was what?
Prescribed other medications.
Did you ask what other medications there were?
Yes.
And did she tell you?
Yes.
Did she tell you who prescribed them?
Yes.
It's pretty easy to get a list from CVS, right?
Yes.
And did you have any difficulty determining who was providing the prescriptions for all of these medications?
No.
And did you know that, in fact, it was Jennifer Tufts that prescribed the Sertraline, September 15th of 2022, 30 count, 25 milligrams was Jennifer Tufts. You know that?
I did.
You know that Jennifer Tufts on October 21st, 7 count of lorazepam. You know that?
I did.
And 5 days later, Jennifer Tufts prescribed on October 26th hydroxyzine, 25 milligrams with a 30 count. Did you know that?
I did not know that.
Did you know that on the same day, Tufts prescribed 30 count of lorazepam? Did you know that?
I would have known that, yes.
I was
Checking the PMP for controlled substances, yes.
You do recall that you checked with it?
Yes.
When you download that information and kind of put it in the file,
No.
So is this your memory that you believe that you checked with PMP?
I do routinely check the PMP.
You might routinely check, but did you check?
Yes. Yes, I did.
Don't download it, you don't keep it with the medical records, right?
It's a box you can click in the medical record and you can check that you reviewed it.
Okay. Is it in your medical record that you reviewed it?
I'm not sure how it would have gotten printed out. It doesn't like go into my note, but it's a box that I would have
Brought
checked
the
it.
box in the computer?
Yes.
Okay. October 26, buspirone, 5 milligrams, 30 count, same day by Tufts. You knew that?
Buspirone.
Yeah.
I was not sure that it was Dr. Tufts that had recommended the buspirone.
Okay, so if I suggest to you that the prescriptions that we have in evidence in the chart indicates that on October 26, Dr. Tufts prescribed a 30 count of buspirone, would that either refresh your memory or would you accept that as being a medical history?
I would accept that.
And what is buspirone?
It is a medication used to treat anxiety.
Okay, and lorazepam, what is that?
Benzodiazepine.
And hydroxyzine, what is that?
It is an antihistamine medication.
And lorazepam, again, prescribed on October 21st as well as 26th by Tufts. That's the same thing you just told us what lorazepam is, right?
Yes.
Sertraline, of course, is Prozac, is that right?
Zoloft.
Zoloft, Prozac, they're both SSRIs, right?
Yes.
So from October 21st up through November 9th, she was prescribed all of this group of drugs until she saw a Kayvon Izadapana, Izadpanah. Do you know who that person is?
They work in the emergency department at Social Health?
All right. And that would have been on November 16th when she went into the emergency department, right?
Yes.
Prescribed trazodone, 50 milligrams, right?
Yes.
And then she started to consult with your clinic around the 25th of November. That would be around Thanksgiving or so, correct? November 25?
I believe her first visit with Julia was November 21st.
Okay. So what I'm saying is that it was around that time in November that she started to consult with your clinic, correct?
Correct.
You know that she was referred to your clinic by her mother-in-law, Pat's mother, who was a labor and delivery nurse.
Yes, I am aware.
Referred her to Julie Paul, who kind of stepped in for a very short period of time to try to help out, right?
Yes.
And then Julie left, went to New Hampshire to continue her work, and you picked up on November 30th of 22. Is that right?
November 29th.
On November 30th of 22, you wrote a script for quetiapine, 30 count. Is that right?
Yes.
And what is quetiapine?
Seroquel.
You also, a week later, wrote a script for diazepam, 5 milligrams. Is that correct?
Correct.
And then the next day, you wrote a script for, December 6th, you wrote a script for diazepam, 5 milligrams, right?
Correct.
December 7th, you wrote a script for diazepam, 5 milligrams, right?
Correct.
December 7th, again, you wrote a script for quetiapine, 30 count, right?
I would need to check my...
You can look at anything you want. If
Okay.
you have your records, feel free, please.
Okay. You said
Yeah, it would be
December.
December 7th. And I'm looking at quetiapine, 30 count, 100 milligrams.
I don't believe it was a 30 count of 100 milligrams.
Do you remember writing quetiapine script for 100 milligrams?
I do. I believe the quantity was 22.
22, okay. So on December 7th of 22, you wrote a script for quetiapine, and forgive me, I'm sorry, what is that again?
Seroquel.
Seroquel, for 100 milligrams, right?
Yes.
And why did you write the script on November 30th for quetiapine, 25 milligrams, and then about a week later increase it to 100 milligrams?
On November 30th, I had anticipated utilizing it over a 4-week course of treatment for sleep and anxiety. But her clinical symptoms, presentations changed, and we opted to use it for mood stabilization.
And who's we?
Me.
Okay. And were you working with anybody else, any psychiatrists or anybody?
No.
So when a person comes to your clinic as a woman who has recently had a baby or is within that postpartum range of time, and presents with the symptomology that she presented, is that something that would give you cause for concern? Suicidal ideation?
I in no way want to minimize what Lindsay experienced, but it's common for us to treat.
It's common to treat women in that
Yes.
fashion that are postpartum?
Postpartum who may have suicide. Oh,
Keeps cutting off the witness before she gives an answer. May she complete her answer?
Sure. As I've said before, let's only talk one at a time. You finish your answer, and then we'll go to the question.
Go ahead.
her symptoms were serious, and it's not uncommon for me to treat women with serious symptoms in the postpartum period.
Okay. 2 days later, you prescribed 8-count 5 milligrams of diazepam. Is that right?
2 days from December 7th?
Yeah, it was December 9th.
December 9th. Yes.
What is EPDS? What does that mean?
Edinburgh Postpartum Depression Scale.
All right, so would you look at November 21st, please, which would be, so November 21st, she was administered a Edinburgh test, right?
On the 21st. That would have been at Julie's appointment. I don't have that in front of me.
If I told you that, well, on November 21st, it's a short period of time after November 17th, did they, whether it's Julie or somebody else, administer an Edinburgh test to her?
Yes.
And what was the result?
23.
That's severely depressed, isn't it?
Yes.
And when was the first time that you actually met with Lindsay?
November 29th.
Okay. Which would have been after Thanksgiving, obviously, right?
Yes.
And you would have reviewed the records up to that point, right?
Yes.
So one of the things that you would have reviewed was what she had indicated or reported to Nicole Harden Francis. Do you know her?
Yes.
And who is Nicole Harden Francis?
She's the nurse at our program.
All right, and this would be on November 28th that she was speaking with Nicole, the nurse. You read the report before you met with Lindsay on the 29th, right?
Right.
So you knew that she had been reporting panic symptoms, that she was disoriented, that she was forgetful, that she was not connected to her body, is what she told her, right?
I would have to review that just to be accurate.
She told you, and you can pull it up if you have it there, that she was not able to stop or control worrying, and that had been for several days at least, right?
Correct.
And she was worrying and stressing about things, worrying about different things every day, right?
Nearly every day, yes.
Couldn't relax nearly every day. This is a questionnaire form that you have, right?
Yes.
Being so restless nearly every day, correct?
Correct.
Asked if she was annoyed or irritable, and she said not at all, sure, like she didn't believe that she was a person that would be irritable or angry with people, right?
Yes.
And then feeling afraid as if something awful might happen, and she got that GAD 7 score of 14. Is that correct?
Correct.
So what does a GAD score of 14 tell you on November 29th?
Moderate anxiety.
And then you ask about in the last 7 days, trying to get a history. She denied, definitely not so much now, that she was able to laugh or see the funny side of things, right?
Right.
And that she was asked, is she looking forward with enjoyment to things? And she responded, hardly at all, right?
Yes.
You indicated that if you're not sleeping well with Valium, no need to continue it. I'll prescribe a short taper. And you went on about tapering and 5 milligrams of Valium to 2.5 milligrams and no benzos. And
That was not on November 30th.
okay, does it say on the record, are you looking where it says patient message in the perinatal behavioral health program of South Shore Health, November 30, 2022?
Yes, I'm looking at the messages.
Okay. So is it a different date?
I'm going to allow that. The jury can weigh that. You can explore that on cross-examination. Redirect, I'm sorry.
From your treatment of Lindsay and her efforts to be a good patient and tell you all what her symptoms were and third-party contacts and everything, to your opinion, she would have signed a release for you to get access to pretty much anything you wanted, right?
I'm not sure if she signed a release for McLean to be able to speak with us.
Did anybody ask her? Did you ever ask her to sign a release?
I did not.